Yay. And then we will go ahead and get started. Here, let me go ahead and share my screen, which we want to do that one, I believe. Okay, there we go. Do you see, is it the welcome to week 2? Is that what's on your screen?
Yes.
Yes, thank you. Okay, so welcome to the week 2 walkthrough. First of all, I wanted to check in and see how everybody's doing. In week 1, it was a busy week, but people got through it and did a nice job. And how are you feeling? How's the workload? How's communication? You can put it in the chat. You can say something out loud.
I think it's good. It's very easygoing. We can all talk in the chat if we have any questions. And yeah.
Oh, good. So yeah, I think I'm hoping that that's helpful. Somebody was having trouble getting the journal template, so I think we finally got that figured out. So good. Yeah, feel free to you can private message me from the chat. You can put questions in the group chat. That's a good thing. So now this week we are going to start talking about Healthy People 2030 and government influences on growth and development and social determinants of health. So what we're trying to do is, build a foundation as we start to move through the different developmental stages, because we will go from preconception through death and dying, but we also want to know, especially as healthcare professionals, what are things that are influencing growth and development so that we can help prepare people with the anticipatory guidance, like knowing what's going to happen, things to look out for, things to be prepared for, as well as health education and also resources if people need different resources. So I thought we would start with the page. I have flipped it over to the week 2 landing page. So that is there. And you notice again that there are recent announcements. So those, I did a Saturday night check-in and a midweek check-in. I don't always do 2, usually in the first week because there's so much going on. I try to. And then there's the welcome to the week. So I'll do that announcement every week that kind of lists everything for you, everything that that we're doing and what is due. So you have those as resources. And then again, this will link to the week 2 module, which we can go ahead and do just so everybody can see that. If it works, there we go. And so it takes you right to the week 2 module, which I can put in, no, I can't, as student view. Maybe, there we go. So I don't need week 1. So week 2, there's at the overview, which is what we will go over. And then each part is broken down into a specific lesson. And then you have the assignments that are due, and then the focus areas for the quiz, as well as the quiz. How was the quiz for people? The class as a whole had a 95%. So I thought that was good. Yeah. Okay. Judith's giving a thumbs up. Thank you. I will say, and again, speaking to the entire class, make sure that you check back for feedback, because some people, only very few left it until 11:30 Sunday night. So that was, or 11 o'clock on Sunday night. Very few did that. So that was a good thing. And then there were students who missed a few questions, or for the short answers weren't either like specific or not enough, or in depth enough, or maybe didn't write the whole 5 sentences. And so points were deducted for that, but I left feedback so that you had a chance to go back and do better. So one of the tips would be, especially for any short answer questions, is to go ahead and write those on a Word doc or a Google Doc so that when I give you feedback, you have it. Like if you can't see it on the quiz itself, sometimes that's really helpful. And then you can just add in the parts and then copy and paste it into the second attempt. But please, I did have several students that took their second attempt and earned the full credit. So that is a good thing. So I encourage people to do that. And you do have the focus areas. So those will try to kind of focus things down because there's a lot of information. So hopefully students found that helpful as well. And so I will also post this walkthrough here on the page as well. And so we're going to explore according to the course objectives, the governmental influences, and relate how Healthy People 2030 goals and interventions can be implemented in a local community setting. So what I'm going to do is run through not the lesson per se, but everything so you know what to expect for the week. And then once I get through looking at all the assignments and those kind of things, if you would like me to go back through the lessons, then I can do that as well. So we always relate back to objectives. So we're relating this particular lesson back to the course objectives 13 and 14 of the 16 objectives. And then we will break each lesson down into lesson objectives. And there will be a little icon here. I have several different that I use that will tell you what today's learning objectives are for governmental influences. And so examine them, define healthy people, be able to discuss one health issue or goal in each age group as defined by Healthy People 2030. When you go and explore that on your own, you'll see what that means. And then explain the role of the healthcare professional, you, in providing health promotion, how to keep people healthy and achieve some of these goals that are mentioned. So the next part on there is the reading. So again, there is no textbook, no one textbook, I guess I should say. So these are links to different articles, different web pages. So this is the reading that I would like you to do for this particular lesson. There's a little video that talks about Medicare versus Medicaid, or Medi-Cal as we call it in California. These are the links to Healthy People 2030. We will go into this in more detail when we talk about the assignment that is due for this as well this week. And then you have your assignment, which is a community windshield survey, which we'll go through in a minute. And then this is the, you click on that and it takes you to the lesson, which has, again, the reading, mostly the same reading. I did not check these links. I will go back and check these links because one or two did not work on the other page. And then let's take a look. There's a PowerPoint, there's a video. Most of the information is still very current, although some things are changing. A lot of things change state by state. But if you click on these different pictures, like this will take you to the Social Security Administration. It should open up in a new window for you to find information. Covered California is an insurance program that is in California. You click on that, it takes you there to see what is expected, what you need to do to apply for that, what the qualifications are for that. So you just click on those links. And then we also have private insurance as well. There is a little video here, which I think is kind of interesting. Tariq does a very nice job, which is why I keep using the video and talking about, is healthcare a right or a luxury? So that's a good point to think about. And then just a couple more videos on Medicare, Medicaid, and also different supplemental programs that happen with Medicare. And then this particular video is about the role of government in healthcare. We've got a lot of hot topic issues going on right now in the government. So I think these are all very timely. And I also thought that was an interesting one. And then also a lot of times you'll hear Americans talking about, oh, we should have socialized medicine, especially now social media, right? There's all these, I don't even know what you call them, like YouTubers or people that do reels and they're out on the streets asking people questions. And So a lot of different information here. And then you have your journal. Then many people have started sharing their or shared the link with me for their journal. So that's great. I appreciate that. Keep doing great work. And then these are the questions that will go in your journal. If they're not already there, which I don't think they are for week 2, you just copy and paste these into your journal and answer them. So let's talk about the assignment. This particular assignment is called a community windshield survey, and it is meant to happen in you, the students' own community. We do this particular exercise or project in the nursing program, in the RN program, and it actually is a 3-semester project where the students will go through and look at assess a community and then plan an intervention to implement in their 3rd semester in the program. But for our purposes here, what we're trying to do in regards to the social determinants of health is to look and see where you live in your neighborhood, or someplace that you're curious about that you want to study, is to see what different types of social determinants of health that you can see that are there things that are safe. What's the environment look like? Let me go to, that is not what I wanted. There's the rubric. So basically these are the objectives when you're looking through social determinants of health. I'll go back to social determinants in a minute. And you're going to say, for example, we take by Hartnell College, the campus 93901 is the zip code. And so this is the community that I would want to study. I'd want to learn about and see what I think. And I can, you know, if you're going to walk in the neighborhood, make sure you're safe. You could also windshield survey. Actually, that's where it gets its name from, is driving through the community. And so if you find from the chat that there are students that live in your same neighborhood, you could go together. That would be nice. And then there is a survey tool here that I will show you momentarily. Take notes as you go through the community. You could take videos. Sometimes students will, either when they're walking or driving, they'll take videos on their phone or take pictures. And then you're going to prepare a little presentation analyzing how the social determinants of health that you saw, how they might influence the growth and development of residents in your community in different life stages. And then think about, is there anything in your community, or based on what you see, are there any interventions? Are there some ways that you could help, you know, in your neighborhood? So let me go back. Let me go back to the module for a minute, and let's go back and look at social determinants, and then we'll come back to that, because if you haven't looked at those yet, that will be a little bit difficult. The reason we talk about government influences is because government, although considered a structural determinant of health with policies and economics, it does play a part in social determinants of health. And so that's why we want to look at that first, and then look at healthy people and social determinants of health. And I thought I had, yes, I knew I had a graphic. There we go. So when you think about social determinants of health, this is one of the basic graphics that you see. And we talk about healthcare access and quality, neighborhood and built environment, which is what you're going to be going through, social and community context, economic stability, educational access and quality, those 5 areas. And those are things that are not inherent with us. It is not our race, our ethnicity, our age. It is factors that are social, that are around us, that shape how we stay healthy or don't stay healthy, how we grow, how we develop. So those things are in there. And then let me go back to the assignment for the community windshield. And then there's also one on social determinants. It might be helpful to do that assignment first. You have 2 weeks to do the community windshield. So that one is not due until next week. Let let me go down to here. There we go. So if you do the social determinants of health first, that will help you, and then you can work on this one as well. So assuming that we're in 93901 and we're going to use this particular tool that I'm going to pull up here for you as we go through the neighborhood, things that we are going to look at would be boundaries. What is where does the neighborhood start and stop? Is it a certain geographical area? Are there different little areas that have names, little neighborhoods within that zip code? And how do you know that? For example, there's the Los Olivos Riker neighborhood. There's like a big sign, like, so everybody knows that's where that is. But there are other neighborhoods as well. How are those defined? As you're going through, look at the age of the houses. You could even look up on like Zillow and see, that could be a resource, right? And look and see how old some of the houses are in the neighborhood. Do they look like they are falling apart? Are they well constructed? Are there any signs of decay? Is there like garbage all over the place? Are there a lot of abandoned cars, vacant lots? What about parks and recreational areas? Are there playgrounds for the children or parks around? Any common areas where people hang out or gather? Are there signs, are there welcoming signs? If you were new to the neighborhood, would you know, besides Starbucks, where to go and hang out? And then in terms of stores, is there a grocery store? Is there a pharmacy? Is there a gym? Is there a hospital? Are there doctor's offices, dentist's office? How much fast food is there? Are there any organic food stores or ethnic food sources around? How many, what's the price of gasoline? Which leads us into looking at transportation, right? How do you see a lot of cars, bikes, buses? My son is up in Davis right now with his girlfriend, and a lot of bikes and a lot of walkers, not as many cars there. But what do the streets look like? Are there a lot of potholes? Excuse me, is there easy access to the highway if people go to work, for example, in Monterey or maybe in San Jose? So these are different things that you are going to be looking at and or getting information from like the county website, a county website, for example. Any posters, billboards, how does information get communicated? A lot of neighborhoods are now on Nextdoor, which is an app. I'm sure there's other apps. But there's one for Marina and Salinas and different neighborhoods in Salinas. That's a way to communicate, and people, let each other know, hey, I lost my dog, or do you know a good plumber? Things like that. Are there schools, any social services around? Do you see people out and about? And what are they doing? I guess at 5 o'clock, are there a lot of people? Are there more people at 3 o'clock when some workers get off of work? What kind of industries? Is it agricultural or not? Are there protective services? Is there a police station? Do you know where to go if you need help? Is there a fire station? Those types of things. And then are you able to determine, for example, ethnicity or religion? Are there specific churches, places of worship, synagogues? Are there centers for different ethnicities and races? I guess ethnic centers. And what do the people look like? Are there certain places, for example, Chinatown is an example where there would be drug and alcohol abuse. You would be able to say that. And then any evidence of political activity. So these are just some prompts for you to think about as you go through your particular zip code. And that's what you are, that's what you're doing. So then you look at the rubric. Always go by the rubric. And if you're having trouble trying to figure out how to put your paper or project together, it will tell you in the rubric where the points, or the majority of points especially, can be found. So did you identify the community? Did you use the checklist? So that checklist I just went through, how detailed or how much information is on that checklist? Did you include notes that you took? Did you put in some pictures or add in a video? And then based on the information that you gather, you're going to then relate that to the social determinants of health, those 5 things that I showed you in that graphic. And so in what way might your analysis of the social determinants of health influence growth and development of residents across different life stages? So say, for example, we looked at, in my neighborhood, not my specific neighborhood, but like across the street, is a playground. So there's a couple playgrounds actually there's 1, 2 that I can think of off the top of my head, 3. So that would be helpful for children for growth and development. There are a couple schools nearby. There's Hartnell College, which is there's Palma, and there's in various neighborhoods other elementary schools. So those are good things. What programs do those schools offer? Maybe those are helpful things. Are there any adult daycare centers or anything for seniors or middle-aged people to do? So those types of things are what you would put in there. I would probably address as many of the 5 as you can in there, and see what evidence you found of those. And it is worth 20 points. So it is a good number of points. So my suggestion would be not to leave it till the day before it's due. If you're going to use your neighborhood, if you're going through your neighborhood every day, maybe each day take a little chunk of that checklist to look, to focus on as you're driving through the neighborhood, take some notes or whatever. And then you will over several days have compiled a lot of that information. Then you can go to county websites, you can go to city websites, you can, if there's certain things that you, if there's like a specific church that you see or a center, then you could look that information up online as well to include as some resources. So is that clear as mud now? Again, you can always ask questions in the chat, but that's kind of what the expectation is. It's not kind of, that is what the expectation is. And that's why you have 2 weeks to complete that. And then I'll wait and see if anybody has any questions. Or at least if it makes sense. Then let's move on to the second part of the lesson. So this is where we talk about Healthy People 2030 and social determinants of health. Let's go down and look at the social determinants of health first. And so we looked here at the graphic, and then each part here: economic stability, educational access and quality, healthcare access and quality. Each one of these links will take you to information about that particular social determinant. And then this link tells us why are social determinants of health important? Why do we study them? What do we hope to find out by studying them? What are they and why are they important? So that's a good resource there for you. So let's try healthcare access and quality. That is something that can be, healthcare can be difficult to access. The quality of healthcare is not always what we hope it will be sometimes. So I am now on the Healthy People 2030 website. Healthy People 2030 has actually been around. I remember when it was 2010, I believe there was a Healthy People 2000 before that. I think that was the first one. And every 10 years, we look at these benchmark objectives that are set, and then we decide, have we done better, worse? Do we still need to work on these? Or maybe something new comes up, and so we add a different objective. And so what you can do, for example, is we look at healthcare access and quality, again, one of our social determinants of health, and the goal, the overall goal for that particular social determinant of health is to increase access to comprehensive, high quality healthcare services. So to get as many people access to comprehensive healthcare services that are high quality services. That is the overview and the goal for that. And then as you look through and scroll down here, there are objectives related to that one particular social determinant of health. And it will tell you here in this objective status that 5 have been met or exceeded. That's great. 8 are improving. However, 5 are getting worse and 12 have little or no change detected. 4 are at baseline, so that means it might be a newer objective that we're just starting to research about. But 5, we've met 5, so that's good. So what does that mean? Let's take a look. So healthcare access and quality in general, right? And it tells you right here, one of the goals is to reduce the proportion of emergency visits with a longer wait time than recommended. How many people go to the emergency room and you wait 3 hours, right? Why is that? That's an access issue and a quality issue. Is it staffing? Are people extra sick? Are there more emergencies or traumas coming in? Something like that. There's been no change in that one. Increase the proportion of adults who get recommended evidence-based preventive health care. We're going to talk about that when we get to the adult lessons in weeks like 6, 7, 8. And there are recommended evidence-based preventive health care, like a mammogram, for example, like prostate exam. And so we want to increase the proportion of adults who get those. Well, apparently that goal is getting worse. There's less people achieving that goal than what we wanted. That's not good either. So what are ways that we can help to make that happen? How can we get more people to get that preventive healthcare or to see the importance of getting that preventive healthcare? And then what it will do, taking healthcare and healthcare access, is then break it down into even more categories. Like, for example, adolescents. Adolescents who speak privately with a provider at a preventive medical visit. Adolescents who had a preventive healthcare visit in the past year. There's goals on cancer, goals for children, increase the proportion of children with developmental delays who get intervention services by 4 years old. So are the, for example, the autism spectrum disorder, the MCHATs, those testings or screenings, actually, I should say, are those being completed at 2 and 3 years old so that we can get early intervention, Head Start programs, get children there. Community, drug and alcohol abuse. So you see there's many different things that fit under that social determinant. And so those would be, you can think about these as you're going through your community. For example, increase the use of oral health care system. Well, gosh, that target was met or exceeded. So that's great. How many dentists did you see as you drove through the neighborhood, or are there dentists nearby? Health communication, health IT, proportion of adults offered online access to their medical record. That's improving. So it's met or exceeded. So hopefully that makes a little more sense. Let's look at education access and quality, just to give you another example, and then we'll go look at that assignment now that we've looked at the website, and I think it will make a little more sense to have done it this way. So education access and quality, the goal, increase educational opportunities and help children and adolescents do well in school. So that's a good thing. I think we've all heard that the educational system in America, our numbers are not as good as other countries. In fact, declining in some instances. Again, there's all kinds of debate going on the government level about, like, for example, the Department of Education. And so what, from a health standpoint, is happening with that, with increasing educational opportunities? So it gives you a little description. You can see that 2 objectives are improving, 2 are getting worse, and 1 has little to no detectable change. So it's kind of just staying right where it is. And then we look down here. And so increase the proportion of high school students who graduate in 4 years. That's improving. So that's a good thing. Students are getting through high school in 4 years. Increase the proportion of high school graduates in college the October after graduating. That's apparently getting worse. So it'd be interesting to look at that particular objective and see why that's happening, if that's happening. I know at Hartnell College, we try to have the dual enrollment programs where students who are enrolled in high school can also enroll in courses at Hartnell. And we also try to we look at time to graduation. We're hoping to get that in like 2 to 3 years. Doesn't always happen, but that is a college goal. And then these are developmental, so they're kind of just starting out. Increased proportion of students with disabilities who are usually in regular ed programs. That seems to be improving, so that's good. Increase the proportion of fourth graders with math skills at or above the proficient level. My guess is that COVID did not help with that. Like here's with the reading skills, it's getting worse. The LHI means that it's a leading health indicator. So of all of these objectives, some of them are leading health indicators, which means that they're even higher up on the list of things, the objectives that we are trying to meet. So why is all of this important in terms of the activity, the assignment that you need to do? So if you go here to the link on the assignment, kind of looks like the same. And so what are you supposed to do? So for this assignment, right, it's on the assignment on the screen. Yeah.
Yes.
Yeah, thank you. And so what you need to do is you need to explore all 5, right? Kind of like we just did. Like you click on the link, you go and see what it says. And then you're going to choose one specific social determinant of health that you want to explore more in depth. So we looked at education, we looked at health access, you know, whichever one you would like to choose. Any of the other 3 is fine as well. And so, for example, which social determinant of health, then you answer these questions, right? This is what you're going to turn in, is why did you choose that particular social determinant? And then what is the goal according to the website? So when you went to the website, remember that goal is up at the top of the page. The goal, increase, for this example, increase educational opportunities. That's the goal. And then review the related objectives, right? And choose one related outcome on which to focus. So remember, we went down and looked through all of these. These are the related objectives. And then after looking at these, we can decide, hopefully choose one that we would like to learn a little more about. So I might choose increase the proportion of fourth graders with reading skills at or above proficient level, because that's getting worse. So that would be the reason I would choose that. I'm curious as to know why. So I chose that. Why did I choose it? Because I think it's important that children know how to read as well as comprehension, and it's getting worse. So I would like to know more about it. And so what data is available? So if we click on that particular goal, now it takes us to that outcome and breaks it down even further. So what data is available? So you could do a web search of it if you wanted to find like research articles or whatever, but this is where you would start. So that is the objective, the most recent data. It's actually from 2024, which is really recent data. So that's great. And the target's 41%. The target isn't even 50% of students can read at or above their level. We would like to see it increase. And so the baseline was 36.6, which is, I think, why we chose 41.5. Let's get it up a little bit and we'll raise it a little more. We'll keep doing it, but we backslid. It went down 31.1. So here is your data. When you click on data, it then will take you to the data page, and it gives you can look, right, there's a graphic that shows you that we were there, and then it just steadily went down. I figured, you know, if these were COVID years, it does not surprise me that the number went down. You can click on the sources to look and see what's available. I think it says learn more data measurements for the objective, right? So play around with the website, see what you come up with. Then there's different infographics that are available, that like putting it in terms of pictures. It gives you the methodology and measurements. So how are they collecting the data, in other words? And then sometimes they'll have the evidence-based resources that you can look at, as well as healthy people in action. This section will often tell you about successes around the country, things that are helping. Like this one that is what Catawba County Libraries leveraging healthy people objectives to deliver more than books. So you could read about that. So going back to the assignment, because y'all want the 20 points, which related objective did you choose? We did that. What data? Are we closer? No, we're not. What explanation do I have? COVID, maybe some other things, but COVID. And what do I think might happen as we move forward? And then look at the evidence-based resources and healthy people action. What did you learn? How are people trying to help with the outcomes? So we looked at the healthy people in action, which was Catawba. So you would look at that and read that. Akron, that would be in Ohio. What are they doing there? So there's a couple different examples there. And then you could read about more of that. So all the information that you need is on that objectives page. Okay. And then based on your research, in addition to the website, how do you think the particular social determinant or related health objective might affect growth and development of children, adults, and the elderly? Provide specific examples. So for example, if I'm taking my objective of the 4th graders being able to read at or above their grade level, how do I think that is going to affect their growth and development? So if they're not reading at a 4th grade level when they're in 4th grade, well, as children, then they're going to be struggling through school and get behind. And if they don't get caught up, they'll just get more and more behind. And then maybe as they become adolescents, they won't go to high school, or they'll only get partway through high school. And then as adults, they won't know how to read or know how to write. And so it will be difficult to get a job, things like that, like in terms of development. That, I hope that makes sense. And then I think this one works. Yes, it works. Yay. So this just breaks it down and tells you kind of each, gives you little pictures of where to look. So just like we went through that website, this is like cut and paste pictures of where we went and how to answer the questions. So it's all right there for you. It's just whatever speaks to you, whichever social determinant, whichever related objective speaks to you is the one that you can write about. Now, this particular assignment, this one is due on Sunday. The community windshield is due not this Sunday, but next Sunday. So those are the 2 assignments, no discussion this week. And then to continue to work on your journal entries, which I believe people are doing well on. Remember on your journals to, to answer the questions as deeply, as thoughtfully as you can, not just 1 or 2 sentences, more than that. Examples from the reading, from class, from any of these recordings, videos. You could embed videos. You could put links to videos or a lesson page. You could add pictures in, something to, this is your journal. It's kind of like I guess I would say portfolio, but you can also think of it as a study guide. It might be something that you can come back to that you might find useful, when talking about, you can put notes in here, like notes about Medicaid or Medi-Cal, or Medicaid or Medicare, sorry, thank you. Those types of things. So that is that. And then the quiz, we did the quiz, right? So let's go through, make sure I covered everything. We did that. We covered governmental influences. We went over the lesson. We talked about the windshield survey. We looked at the social determinants of health. There's more links for you. We went over the social determinants and objectives assignment. This is the link to the Healthy People 2030 social determinants of health, and then some videos that talk about it. And I believe that covers everything. Let me go to the module and make sure, let me view a student and make sure that I have indeed covered everything, and then I will ask if people have questions. Right, so you've got the link to the overview, the 2 lessons. I also posted your accomplishments for week 1. When I do the welcome video, I will give you the accomplishments from week 1. And so I think that's always a good thing to look at and see what you've done, because you accomplished a lot. We tried some, introductory things. Many of you tried these for the first time, which is great. Everybody, I think almost everybody escaped from in the escape room. They got out, so that was good. You are working on your operant and conditioning, the behavioral research project. That's due this week. Working on your journals. Class average was 95% on the quiz, like I said, so that's great. Do you want me to go over the operant conditioning assignment to make sure people are on the right page for that? We covered those assignments, the journal, focus areas. Week 3 is posted. All of that is there. That's not till next week, but I'm just showing you that that's there. And I do believe I opened up week 4 as well. So I'll try to keep ahead a couple weeks for you. So you can kind of see what's coming. Do you want me to review? Anybody want me to review the operant conditioning, or does anybody have any questions on anything in week 2?
Oh, I have a question.
Mm-hmm.
The 2.1, what is it? The windshield assignment. It says that it's due this Sunday, the
Oh, it's supposed to be
22nd.
it's supposed to be next Sunday. I'm sorry. I will
Okay,
change
okay.
that. Thank you. Nope, good catch. Thank you. Let me go in and do that. Oops, you get to see the magic behind everything. There we go. Hold on. So what did I say? The 22nd? So it should be the 29th, right? There we go. Thank you. Thank your classmate. Yay. That's just saved a lot of headaches. Thank you for catching that. Bum, 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 bum. I didn't hear anybody say they want me to review the operant conditioning. So unless somebody, I know Dulce and I actually have reviewed that together, but I'm happy if anybody else wants to do it. It does tell you, let me go back to the modules. It does pretty much lay out how many slides you're supposed to have and what you need to have on each slide. Because what will happen is if you look at the different types of behavioral conditioning, ways that these scientists, I guess you could say, got people to do things, when we start to look at the health, like one of the healthy objectives was that there will be an increased proportion of adults that will get preventive health care. So for example, let's just use mammogram as an example. So how do we increase the proportion of people getting a mammogram when they're supposed to at the right age, at the right time? Is it something that we can give a reward? Do we need to think about adult learning principles, which we'll talk about in week 6 and 7? What ways can we do that? Or is it something that we kind of say, oh, if you go, you're going to get this great feeling, and then we just like show them the pink ribbon or something, and then they know, oh yeah, I have to go get my mammogram. I don't know, something like that. There's many other examples, but that's one of the reasons that we look at the scientific method and looking at the behavioral theorists, right? And as well as Erickson and Piaget that you looked at last week. So how do you talk to a teenager and say, hey, this is what what you need to stay in school? Or whatever, versus how do you talk to a 4-year-old versus how do you talk to a 50-year-old and help them stay healthy to promote health and prevent disease. So those are the reasons why we're looking at growth and development from the lens of a healthcare professional. So hopefully that helps. So that was pretty much all I had. I'm happy to take any questions or stay on if people have individual questions. I just moved that. Let me stop sharing. And let's see. Oh, comments. Oops. No, not. No. Okay. Oh, I lied. hold on, I'm looking at the wrong one. There we go. Okay, so we got those questions answered. Yay. Thank you. I was looking at the wrong chat, so sorry. So I'm good. Let me stop the recording. And